Alfred Nobel, Richard Nixon, Sharon Stone, what could we have in common? Let's see if you got it. All of them have suffered of at least one stroke in their life, and even someone's died because of that. Now, let's talk about my work. It is called Microwave Imaging System for Brain Stroke Monitoring, and David Rodriguez and a PhD student at Polytechnic de Turin. It is important the stroke. Let's see some figures. 1 in 6 people will have a stroke in their lifetime. More than 50 million people worldwide have a stroke every year. And the stroke is ranked like the second cause of death just behind the heart disease. To put everyone in context, let's see what a stroke is. This is a very serious disease that occurs when the normal blood flow to the brain is interrupted for some reason. There are two main kinds, the ischemic one, which is the most common, and the hemorrhagic one, which is the most deadly. The ischemic one occurs when one artery is blocked for a clot. Instead, the hemorrhagic one occurs when a vessel without the brain burns. Normally, the doctor employs imaging-based techniques for the diagnosis, such as CT scan or MRI. They are very reliable and they are the current gold standard. However, they still have some drawbacks, like they are expensive, bulky, and harmful in the case of the CT scan. Because of that, in the last year has emerged different technologies, between of them microwave imaging. This is a technology that relies in the contrast that present healthy tissues and stroke ones. Our aim is to develop a system able to follow up in real time the evolution of one stroke, starting from the diagnosis and moving through the treatment. In general, a microwave imaging system consists of an array of antennas surrounding our domain of interest and radiating it. The two main parameters to take into account there are the frequency of operation and the coupling medium. In our case, we are using 1 GHz and a coupling medium with a permittivity of 20. This is because this presents the base trade-off between penetration and resolution. A real system could be looked like this, a head with multiple tissues and a conformal array of antennas that acts like a transmitter or receivers. With them, you're gonna try to know what is happening inside of the head. You wanna know what is the status of the stroke. This is a problem that is non-linear and it poses. To approach this problem, we are using a differential scheme. Let's see how this works. In a first phase, we can get a healthy tissues and we're trying to identify where is the stroke. This is what I'm gonna call diagnosis. And later, we wanna see how the stroke is evolving. And this could be called the follow-up. In general, it's a differential scheme between two different instants of time. We're gonna take measure of the S parameters in two different moments and do the difference with that. With the S parameters that we measure, we wanna get what is happening inside of the head. In another word, we wanna recover the variation of the contrast inside of the head. For do that, we want to linearize the problem using the distorted Bohr approximation. So we are gonna assume that the variation of the field is gonna be focused in just one small region. So we can assume that the total field could be approximate, like the electric field of the background. Also, for regularize the problem, we're gonna use the truncate singular value decomposition scheme, where the truncation value is gonna be the factor of regularization of our system. Now, let's see some results. From top to bottom, we can see the diagnosis and the follow-up stage. In the top is a half sphere stroke, and this is just the diagnosis. Later, the stroke is just growing and becoming a capsule one, and we see the difference between these two stands. In a similar way that in the previous example, which was all simulation, in the experimental lab we can get similar results. Here we present the reconstruction of one stroke in three different positions. How you can see, the noise affects strongly the reconstruction. How you saw from the experimental result, our system still have limitations. In this last year, we're gonna try to improve the reliability of our system, improving the calibration techniques and the imaging algorithms. I hope you enjoyed the presentation. If you have any question or comment, don't hesitate and send me one message. Thank you very much.